stem cell therapy is the new wave in medicine. How is it done? What are its benefits? And how can our people be empowered to seek safe and effective affordable stem cell therapies? Joining us tonight on NewsLife, an exclusive interview with Dr. Theresa Deischer, the founder of Choice Pharmaceutical Institute, to share with us her insights on stem cell therapy and the practice to be avoided. Good evening, doctor.
Good evening. Thanks for having me here. It's a pleasure to be here.
To start us off, how did you get into stem cell therapy?
I've been interested in regenerative medicine since my graduate studies at Stanford University back in the mid to late 1980s, and became very active in stem cell therapy in the late 1990s, almost by accident. Became very active in the area.
For our viewers out there, in the simplest possible way, what is stem cell therapy?
Stem cell therapy is utilizing very special cells that we all have in our own bodies that have the capacity to regenerate damaged tissue and damaged organs. And those cells are working for us on a daily basis. When we have a large insult like a heart attack, they're not sufficient. And so what we would do is harvest those cells and concentrate them and then return them to the patient where they need them so that we can induce healing.
So stem cell therapy is generally used for cardiovascular diseases. What other forms of illnesses can stem cell therapy be used?
There are 15 products for stem cell therapies that have been approved, 14 in the United States and 1 in Korea. Most of those stem cell products are for musculoskeletal injuries, and the one from Korea is for regeneration of heart tissue. In clinical trials, though, stem cell therapies are being investigated for almost every disease imaginable, and showing very promising and exciting results in those early stem cell trials.
In the Philippines, recently, a lot of clinics and establishments have been claiming offering stem cell therapies, but mostly for rejuvenating purposes to look younger. Is this also the same stem cell therapy that you were discussing earlier?
You know, it was interesting. I had a chance to tour the Asian Mall yesterday and was surprised to see stem cell therapy advertised regularly at beauty salons and whatnot. And most certainly they're not offering stem cell therapy. And stem cell therapy needs to be given under appropriate medical guidance and in the appropriate setting with regulations to ensure that the patients are actually truly being treated with stem cells in a way that will help them. So I think that's just advertising to lure people in, and most likely is not stem cell treatment of any sort.
So in general, stem cell therapy is really for medical purposes and not just for aesthetic purposes?
Stem cell therapies in general are being evaluated for medical purposes and then also for aesthetic purposes. For instance, to treat baldness, male baldness, stem cells are being developed for those indications. I mean, and there clearly are cosmetic applications of stem cells, but again, before one would pay to have those kinds of treatments, you would want to make sure that it was an approved and effective therapy.
You mentioned earlier that you can actually get stem cells from your own body, but there are rumors that stem cells are actually obtained from unborn or aborted fetuses. Is this correct?
That is correct. And the stem cells that are taken from the aborted fetuses are used in some therapies, predominantly I would say cosmetic therapies in some Eastern European countries where there are destination spas where people go. Personally, I think it's unlikely that these would yield long-term effective benefits, and that's because those cells are so young and primitive that they form tumors when they are not in the appropriate environment. And so a very dangerous thing that many people are seeking for regenerative and cosmetic applications.
And how about for you and your company? Do you encourage the use of this process, or obtaining stem cells from this source?
Well, absolutely not. And in our company, we've actually taken a pledge to use materials that do not exploit any other human being, whether that's an embryo or an aborted fetus. We won't work with material from executed criminals, and we won't work with any material that is derived from the exploitation of, say, women who are often exploited for their eggs for research purposes. So.
What are the biggest accomplishments of stem cell therapy so far, and what do you foresee in the future for stem cells and human beings?
Well, I think that stem cell therapy is going to become, a very common therapy, and if developed and used effectively, it will just be part of the arsenal that your doctor uses to treat your conditions. And there are some conditions where we wouldn't want to try stem cells until we tried everything else. And there are other conditions where stem cells will become, the first line of therapy. We're seeing effectiveness of stem cells in so many diseases. It's so exciting to name them. But today we heard from a patient who had been confined in a wheelchair with very severe rheumatoid arthritis and was given 2 rounds of her own stem cells. And the results are, if not almost miraculous for her. So she's no longer confined to the wheelchair. She's able to function, comb her own hair, and we are seeing those types of results in many diseases where before stem cells, adult stem cells were developed, there really was no hope for many of these patients.
All right, thank you so much, Dr. Theresa, for sharing with us your insight tonight.